Hello and welcome. This is another segment of the SIU Medicine Minute. I'm here today with Dr. Brad Schwartz. How are you doing today, doctor?
Very well, thank you for having me.
No, of course. And can you talk about how common kidney stones are?
So basically, the prevalence of kidney stones in the United States is roughly 10%, of which men develop them more frequently than women. The other interesting fact is that since the 1970s, that number has gone up from about 3.8% to where it is now at about 10%.
And what are some of the symptoms of kidney stones?
Interestingly, the stone disease can either present as very, very sharp, bad pain in the flank area, all the way to not having any pain or symptoms whatsoever.
And if you do have kidney stones, what is the treatment like?
There's currently three modalities for treatment. One is the typical water bath or the sound waves that break the stone. You can go in from below with a scope and break the stone with the laser, or you can go directly into the kidney for the larger, more complex stones and take the stones out right through the kidney.
And what should patients know after they get treatment?
The most important thing for them to know is that the recurrence rates tend to be very high. They're about 50% at 3 years, and if you have a family history of stone disease, that can actually be doubled.
And what would you say to people that just want to avoid getting kidney stones in general?
So essentially, it's mainly dietary, but the key is to drink fluids. If you can drink over 100 ounces a day of fluid, the most important of which is probably lemonade. If you can decrease your intake of salt, just table salt, or any foods that have salt in it. And lastly, if you can eat or drink calcium with each meal, that would be a very good way to help prevent subsequent kidney stone formation.
Dr. Schwartz, this is all very interesting. Where can people go to find out more information?
Sure. SIUmed.org is the website that they can go to access different parts of the urologic puzzle, if you will. And then our phone number is 217-545-7123.
Awesome. Are there any final thoughts that you want to leave our audience with?
If you eat right and exercise right and stay healthy, what's good for the heart, what's good for the body is really what's good for the kidneys. So any type of healthy lifestyle overall is going to help prevent and decrease your stone risk.
So stay healthy.
Absolutely.
Well, thank you so much for joining us again today.
Thank you for having me. I appreciate it.
No, of course. And this has been another segment of the SIU Medicine Minute.